For cannulation in pediatric nursing definition. For cannulation is the insertion of a cannula into a vein to provide direct access to the bloodstream for administering fluids, medications, or blood products. Indications: administration of 4 fluids, for example, dehydration, shock. Medication delivery, for example, antibiotics, analgesics. Blood transfusions. Parenteral nutrition. Emergency venous access. Preparation 1. Psychological preparation. Explain the procedure to the child and caregiver using simple terms. Use distraction techniques, for example, toys, videos, or comfort items. Reassure and comfort the child throughout the procedure. 2. Physical preparation. Site selection. Newborns/infants, scalp, dorsal hand, or foot veins. Older children, dorsal hand, forearm, or antecubital veins. Choose a vein that is easily palpable or visible, straight and large enough for the cannula size. 3. Equipment. For cannula, appropriate size, 22G 24G for infants and small children, 20G 22G for older children. Tourniquet or elastic band. Antiseptic solution, for example, chlorhexidine or alcohol swabs. Sterile gloves. Adhesive tape or securement devices. Transparent dressing. Saline flush, 0.9% sodium chloride. Extension tubing, if required. Procedure steps: 1. Wash hands and wear sterile gloves. 2. Apply a tourniquet above the site to make the vein more prominent. Avoid excessive tightness. 3. Clean the selected site with an antiseptic solution in a circular motion, starting at the center and moving outward. Allow it to dry. 4. Stabilize the vein by holding the skin taut. 5. Insert the cannula bevel up at a 10 to 15 angle. Look for blood return in the flashback chamber to confirm vein entry. 6. Advance the cannula slightly, then withdraw the needle while leaving the catheter in place. 7. Connect the extension set or fluid line, flush with normal saline, and ensure patency. 8. Secure the cannula with adhesive tape or N4 dressing. 9. Remove the tourniquet and check for proper flow. Documentation. Record the date, time, site, cannula size, and the child's response. Note any difficulties during insertion. Aftercare and monitoring. Inspect the site every 2 to 4 hours for redness, swelling, or pain, indicates phlebitis or infiltration. Leakage or fluid pooling around the site. Ensure the line remains patent. Flush regularly if not in use. Assess for complications, like fever or discomfort. Complications: 1. Phlebitis, signs, pain, redness, swelling along the vein. Action: discontinue the apply a warm compress, and restart in another vein. 2. Infiltration, signs, swelling, cool skin, or pale area around the site. Action: stop infusion, elevate the limb, and apply a cold compress. 3. Infection, signs, redness, warmth, discharge, or fever. Action: remove the cannula, clean the site, and notify the physician. 4. Occlusion, signs, lack of flow or resistance during flushing. Action: flush with saline to clear blockage. If unresolved, replace the cannula. Tips for successful cannulation in children: use small gauge cannulas to minimize trauma. Employ distraction techniques, for example, singing, storytelling. Involve child life specialists if available. Secure the cannula firmly but avoid restricting movement.